Supporters include Pasadena Water and Power, reminding customers to stay vigilant as scam attempts have increased. PWP will not call customers demanding payment or threatening utility shutoff. Find tips to protect yourself at pwpweb.com/fraud.
Podcasts supported by the UCLA Masters of Applied Statistics program, which teaches advanced data science to working professionals in the evenings. Local industries are invited to partner. Learn more at master.stat.ucla.edu/partners.
Chip implantation, part of satanic ritual, government effort to track people. These are just a few of the things that have been spread about COVID-19 vaccines. So how do you dispel that kind of misinformation, which takes on a life of its own with social media, sometimes even specialty media organizations? Well, there are teams of people specially dedicated to go out into communities where these and other reasons have kept vaccination rates particularly low. And these are communities that often have the highest rates of COVID-19 and where they have suffered the greatest loss of life within families. Joining me, the CEO of Desert Healthcare District and Foundation, Palm Springs-based nonprofit organization, is Dr. Conrado Bárzaga, who joins us to talk about what they're doing. Thank you very much, Dr. Bárzaga. What are some of the ways you're doing outreach, particularly to Latino communities of the Coachella Valley?
Thank you, Larry. It is a pleasure to be on your show. And we have formed an equity collaborative here in partnership with our county Department of Public Health. We have more than 12 community-based organizations and faith-based organizations that are helping us spread the good news and sharing information about COVID-19 vaccination efforts and making sure that our community is getting the access to healthcare resources that they need. We have teams of promotoras and community health workers that are going into packing houses, farm fields, taquerias, restaurants, anywhere there is a group of people that need the vaccine, people that have been disproportionately impacted by the COVID-19 outbreak, and where we see more morbidity, where we see more mortality, which is, as you know, communities of colors here in the Coachella Valley, primarily the Latino community, especially in some of the more rural areas. That's where we see higher morbidity and higher mortality rates. And those are the communities that we are targeting.
Well, and often in those communities, I assume transportation is a huge issue, very difficult for people, and the time off work if they're employed to go and to wait at what may be a distant location. And is there anything that your organization's been able to do to address those logistical challenges?
Absolutely. The beauty of using an equity lens is that when you look at the data from a completely different way than how the Department of Public Health and the CDC and everybody else is reporting the data, you start to look at the data with different colors. And we see communities, neighborhoods, little towns, cities, and neighborhoods where the disparities are more pronounced. And the only way that we can increase access to the vaccine for those communities is by eliminating barriers that they face in accessing the vaccine. We cannot expect someone who might be Spanish monolingual or who speaks English as a second language and who doesn't have internet or reliable internet access and a computer and all those things that we give for granted in this country to access My Turn or callbacks or any of the software that it's being provided by our systems, and expect that we're going to see an influx of communities of colors accessing the vaccine. So that's why we see the results. And the results in our Coachella Valley are very clear. We see that 63.1% of the people that have received the vaccine are white, and only 18.9% are Latinos. When we compare that to the proportion of the community, we see that only 12% of the Latino communities have had access to the vaccine.
So, Dr. Bárzaga, what my specific question, though, is what are you doing to try and get the vaccine closer to people, deal with the time off work that might be needed, those specific challenges?
Yes, so we bring the vaccines. Number one, we bring the vaccines on site. We bring the vaccines to where people live, where people work, where people are raising their families, and that's where they get the vaccine. Also, we eliminate that barrier of accessing a website. We do the appointment for them. We do it in their language. We provide education to them. We try to dispel all the myths that exist around COVID-19 vaccine, and we make sure that we are getting those vaccines into people's arms. And we're also working with employers. For example, we were the first place in the United States that had a massive campaign to vaccinate farm workers. And we're working with the growers, and they're allowing their employees to take time off work and get the vaccine on site. We do it at a packing house. We do it in rural communities where there is little access to healthcare.
That's great. We're talking with Dr. Conrado Bárzaga, the CEO of Desert Healthcare District and Foundation in Palm Springs. Their outreach extends to the far ends of the Coachella Valley. Also with us, we're hearing about promotoras who are specially trained to go out and talk with people in communities where there is resistance or lack of access to vaccines. We're joined by Marisela Blancas, who's coordinator of community health programs at Visión y Compromiso, one of the community organizations partnering with the LA County Community Equity Fund. And as I mentioned, she is a promotora who goes out and does this work. Thank you very much, Ms. Blancas, for being with us. What are some of the most common points of resistance that people in the communities you visit put up to getting the vaccine?
Good morning, Larry. Thank you. Thank you for inviting us to your show. Well, we have a lot. But, of course, as Conrado says, is myths that we are finding that the people have, like after the vaccine, especially men's, gonna have sexual dysfunctions. This is a strong myth that,
Yeah, and that would be a big barrier to overcome, no question. So when someone raises that they believe the vaccine will impede sexual function, how do you respond to that?
Well, we always, direct to the people to find the answers, from reliable a resource like a CDC page, and they can find, the response at that, the myths. But especially with that, we talk with them about that is not true, that why is not true, because it's no, connection between vaccine and sexual dysfunction. So especially we are educating people.
And is that pretty much true with any sort of rumor or belief that they bring up? You just try and point them to the science?
Yes, of course. In when we show them, the page in statistics and etc., they usually they change their mind, and it's not true. It's not true. It's just a myth. It's a rumor.
All right. And going out into these communities, do you find that people are willing to talk to the promotoras, to hear what you and other team members have to say about the importance of vaccination?
Yes, we talk, as I said, the statistics, and we always talk about, because they have, fear about the secondary effects. But we would talk with them about, okay, you're gonna have a little headache or arm pain, but that second effects versus, the old stuff that we see, like a dates, that's terrible information. they usually say, oh, okay, maybe if I see these side effects versus the reality of this virus, they change their mind. That is nothing, the little headache or arm.
Yeah. What about the age? You mentioned men seem to be a little bit more resistant because of the sexual dysfunction concern. Do you find that older people are more skeptical, or is it younger people who are less certain about it?
I want to see after 25 years old, they just start to worry about this myth.
Okay. All right. I want to thank you so much for being with us. That's Marisela Blancas, Coordinator of Community Health Programs at Visión y Compromiso, one of the community organizations working with the LA County Community Equity Fund. She's a promotora who goes into communities offering science-based information about vaccines, also tries to help people deal with logistical hurdles to getting vaccinated.
Hi, it's Tig Notaro, host of the podcast Don't Ask Tig. Each week, I sit down with a trusted friend and answer listeners' most pressing questions. I hope you'll join me on April 8th for a very special live show on Zoom with my good friend Nick Kroll. You may know Nick as the star and co-creator of Big Mouth. He is also the creator and star of The Kroll Show, The Oh Hello Show, and The League. Against our better judgment, Nick and I will weigh in on your trickiest quandaries, all from the comfort and safety of your home. I can't promise good advice, but I can promise a good time. Tickets start at just $12. Get yours today at don'tasktig.org/tickets. See you there.